There's a worrisome discussion unfolding in the world of higher education among aspiring professionals who, if the Trump administration has its way, could find themselves blown off the path towards graduation. Our James Ford has the story.
This story is about people who want to become nurses, teachers, physical therapists, social workers, and other occupations who now face a financial challenge to pursuing those careers. But as some of them point out, this is also a story about their communities.
We're actually very concerned. It would have a domino effect.
An effect in their communities from a vote in Washington. The big, beautiful bill passed on July 4th along party lines. Among financial changes it made, on the list of professional programs of study eligible for the maximum federal loan aid of up to $200,000, education, social work, physical therapy, dental hygiene, occupational therapy, architecture, accounting, and nursing were removed. It's unassuming, but in this building is actually one of the biggest nursing schools in the state. And around here, this topic is red hot.
How we're going to find ways to afford school, because school's getting more expensive.
She's among the 560 students in AMG Nursing School's licensed practical nurse program. It feeds into higher professional level programs that now face the possibility of their federal funding being slashed in half.
They are worried about who's going to fund it.
And someone who's been able to complete a higher level nursing program says that any reduction in federal aid in professions that help people ends up hurting people, especially those most at risk.
Their safety net, which are the ones that are being impacted mostly.
The so-called safety net hospitals that nurse practitioner Michelle Jones talks about are set up to specifically help communities least likely to be able to pay for health care. And many people who want to be nurses at those facilities are from the neighborhoods they serve.
It impacts communities of color, black and brown. Many of us are immigrants.
With a real drive to achieve, say many students.
If you really want to do it, you'll get a loan. So there's options. I mean, it's not good, obviously.
Especially because loans not from the federal government tend to be much more costly, according to the Federal Department of Education. But it also says that 95% of people affected by the change will be in programs whose costs are low enough to still allow them to get federal loans below the $100,000 limit to fully fund their education. As for programs that qualify for maximum loans, they include many other health professions like medicine, pharmacy, dentistry, and optometry, as well as theology. People studying for religious ministry are professionals, says the Nurses Union, but it also says
nursing is a profession. We are the most trusted profession 21 years in a row.
According to the Gallup polling organization, the proposed cuts to funding for studying nursing and other professions won't be final until July, so it's possible the cuts could be reduced or even canceled by the federal government. It also says there are more patients now than nurses. So if it reduces funding for pursuing a nursing career, aspiring nurses say this.
We're going to have more of a worse nursing shortage.
For Community Close-Up, I'm James Ford.
Let's hope that situation can be worked out to give them the chance to do that unbelievably critical work.